Guys, welcome back again to my YouTube channel. So for my today's content is what is enrolled nurse in Singapore. So finally I able to make this content. So before that, don't forget to like, share and subscribe my channel if you enjoy this. So let's start now. Definition of enrolled nurse: assist registered nurse to provide holistic nursing care to patient. So the average salary of enrolled nurse is 1,750 Singapore dollars. So, taas, diba? Then, enrolled nurse can be promoted as registered nurse. I think I explained this already before. Enrolled nurse work pass or visa category is S-Pass. So now, let me explain the generic skill of enrolled nurse are the following. So, administration of fleet enemas, suppository, nebulizer. So, usually, staff nurse ang magsasign yan, hindi enrolled nurse ha. Administration of topical medication like your creams or your eye drops. Then, of course, remember the 5 rights of giving the medication. Serve pre-pack individual oral medication according to organization policies. Like what I said, usually staff nurse lang ang nagsasign. Some nursing home, they will send their enrolled nurse in training so they can serve medication. But in my workplace, only registered nurse is allowed to sign in electronic medication record. So usually, enrolled nurse will assist in serving oral medication but still depends on organization policy. In some hospital, they will allow enrolled nurse to regulate IV fluids. And what else? Assist in lifting, transferring, yan, buhat-buhat lang tayo. Then, assist patient to use walking aid, assist mo sila maglakad, operate continuous passive movement device. Hindi ako masyadong sure about this. Then, perform range of motion exercise. Siyempre, pag mga bedridden, kailangan i-assist sa ganyan. Then, perform nutritional status screening. And what else? Actually, hindi ako masyadong aware sa nutritional status screening. Serve different types of diet. Ito yung magpapakain ka ng pasyente. So, either orally or via NGT. Then, perform oral feeding. Ito yung oral feeding na sinasabi ko. So, ikaw magpapakain ng pasyente. Then, perform accurate intake-output balance charting. Ito, lagi itong ginagawa ng mga enrolled nurse. Insert and remove nasogastric tube. Pero may mga ibang company, guys, hindi inaalaw. But in my hospital, they don't allow enrolled nurse to insert nasogastric tube. Perform and monitor enteral tube feeding. Then, perform gastric aspiration. Assist with toileting. Perform female adult catheterization. And assist in male adult catheterization. Singapore, by the way, only doctor is allowed to insert catheter to male patient. But unless you attended a training in insertion of male adult catheterization.
Bulaga, nandito pa ako.
Else, monitor patient on continuous urinary catheterization and collect catheter urine specimen, change colostomy bag of course, perform insertion of oropharyngeal airway, suctioning, administration of oxygen therapy, assist with incentive spirometry, supervise patient in coughing and deep breathing exercise, then perform function test of manual resuscitator. Ito yung ambo bag, guys ha. Vital signs, assist in full risk assessment, yan yung BP, SpO2 nyo, heart rate, pulse rate, yan dapat nyo assess. At saka yung mga high risk na mahulog, kayo yung mag-a-assess din. Perform neurovascular and conscious level assessment with supervision. Ito yung mga GCS nyo lang. Perform admission, transfer, discharge according to policies and procedure. For documentation, evaluation, and report with supervision. Sa Singapore, by the way, usually, ang nagcha-charting lang ang staff nurse. Tapos siya rin yung mag-e-endorse sa next shift. Yung enrolled nurse, mag-e-endorse ka sa kapwa mo enrolled nurse or pag may special endorsement ka. Ito yung sa setting ng hospital namin ha. So, sa acute setting, I'm not sure. Perform personal hygiene, grooming, perineal care. Ito, basic na to. Ito yung ginagawa ng mga junior nurse. Ito yung mga ginagawa ng enrolled nurse or nursing aid pag-assist. Perform turning and positioning in bed. Yan, syempre kailangan natin gawin yan. Apply hot and cold application. Sa mga bago pala, I'm explaining the duties and responsibilities of enrolled nurse. Apply and monitor physical restraint according to hospital policies. Apply and monitor pressure relieving Ito ata yung air mattress, pero hindi ako ganun ka-sure guys ha. Then ano pa ba? Perform pressure injury risk assessment. Pre and post-operative care. Syempre pag nalagay ka sa OT. Send and receive patient from operating theater and procedure center. Perform procedural monitoring and observation. Then assist in intravenous therapy. So ano ba yon? Schedule 24 infusions, prime and connect infusion set, regular infusion rate, monitor and observe, then monitor and operate infusion pump and equipment. Then ito, assess wound. Dito usually enrolled nurse ang gumagawa ng wound dressing. Perform staging of ulcer and wounds. Perform stomach care. Siyempre papalitan mo yung wafer. Dapat marunong ka. Health teaching for self-care in wound dressing. Yung pag madi-discharge yung patient, dapat turuan mo sila. Perform glucometer calibration. Perform peripheral blood glucose monitoring. Yung mga hypocount. Administration of subcutaneous insulin. But some institution na hindi ina-allow to, hindi ina-allow ang enrolled nurse. Perform that procedure, syempre, dapat, depende pa rin sa protocols. Facilitate grieving process support for the bereaved family. Of course, pwede natin gawin to. Pwede gawin to ng enrolled nurse. Perform basic cardiac life support. Yan, syempre, pinaka-basic yan. Perform automated external defibrillation. May training ka naman natin. Ito, perform hand washing. Sino ba naman hindi marunong yan? Adhere transmission-based precaution and isolation procedure. Dapat alam mo yan. Mga precaution. Perform sterilization, disinfection, adhere to sharps and splash injury, prepare and use sterile equipment, identify problem to care delivery, then perform waste management. Hindi ako sure dito ha, pero kasama yan. Make a clinical decision in accordance to professional standard and scope of practice. So, hindi ko na-explain masyado. Reflect on practice. Respect patient right. Yan, dapat tandaan nyo yan. Demonstrate sensitivity and cultural diversity. Preserve patient dignity. And demonstrate accountability, responsibility, teamwork, and good customer service. Then, utilize health education. Types of nurse specialization. So, community health, geriatric, critical care. So, ako nasa geriatric ang peg ko. Then, infection control, oncology, orthopedic, renal, diabetes education, neuroscience. Itong renal, okay to. Nutritional support, pain management, rehabilitation, rheumatology and immunology, then ENT. Itong emergency, medical, surgical, pediatrics. Dream ko yan pumunta ng emergency department or sa ICU. Feeling ko kasi napaka-smart na mga nurse na nandun. And next discussion, Singapore healthcare system. So, tuturo ko sa inyo yung mga, ano yung klase ng healthcare system ang meron sa Singapore. Then, sa Singapore may tinatawag na General Hospital. It provides multidisciplinary inpatient and specialist outpatient service with 24 hours accident and emergency department. Ang sample nito, yung Singapore General Hospital, Changi General Hospital. Ito yung malaking hospital nila rito. So, parang sa Pinas ata, ito yung tinatawag nating St. Luke's Medical City. So, ayan yung General Hospital na tinatawag. So, merong private, meron din government. So, meron din mga JCI accredited yung General Hospital nila rito sa Singapore. Of course, Singapore, first world country to guys. Kaya, maganda yung service na nabibigay dito. Gusto ko mag-work sa General Hospital din pag nagkaroon ng chance para maganda yung exposure. Then, specialized hospital provides special care for maternal and child. Example nito yung KK Women's and Children Hospital. So, sa mga buntis or sa mga bata. Then, mental health. Ito yung IMH sa mga PSY medicine. Ay, mga PSY patient. Meron silang ganyan. Then, specialty center provide treatment for cancer, cardiac, eye, skin, neuroscience, and dental issue. Meron ding hospital na ganyan specialized. Kunwari, National Heart Center, National Skin Center. Meron ganito dito sa Singapore. Then, community hospital, which is provide care for patient who requires a period of recuperation. So, dyan ako nag-work pero hindi ko sabihin kung saan. Community hospital ako guys. Kaya wala kaming 24/7 admission. Next time I will discuss kung anong ginagawa namin sa community hospital. So, yung mga pasyente sa community hospital, usually galing yan ng general hospital. So, from hospital to hospital, wala kaming emergency department. Next is polyclinic, which is provide subsidized primary care, which includes medical treatment, health education, preventive healthcare. So, ang pagkakaintindi ko rito, parang clinic to, pero government. So, mas mura. Ayun ang pagkakaintindi ko. Parang siyang maliit na hospital. Mali man yung info ko regarding sa polyclinic. Pa-search na lang guys Hindi kasi ako masyadong aware sa polyclinics. And usually, I don't see foreigners na nag-work sa polyclinic. So, next is family medicine clinics, which is provide medical care with support services for chronic disease management. So, usually, private to pagkaalam ko. And usually, yung example, magpapasiklib ka. So, dito ka pupunta. Then, what else? Community health center. This community health center, hindi ako masyadong confident i-explain to guys. Pero based on my research, ang community health center is, ano bang ginagawa dito? So, syempre sa community. It works with GPs to support patient with chronic illnesses within the community. So, what yung isusunod ko i-discuss sa inyo is what? Residential-based services. So, ano-ano ba tong residential-based services in Singapore? So, example is nursing home, which is provide long-term residential care for those who can't be cared at home and require assistance with activities of daily living and or daily nursing care. So, I think di ko na kailangan explain to, pero before nag-work ako sa nursing home, medyo mabigat yung trabaho, pero ang dami mo ring aalagaan. At pag nag-work ka sa nursing home, kailangan mo talaga ng mahabang pasensya. Lagi ko sinasabi yan. So, marami ring nursing home dito sa Singapore, guys. Next, community hospital. I won't discuss this because I already discussed it. Next, inpatient hospice, which is provide care to patient with life-limiting illnesses. Emotional support is also given to their families and caregivers. What else? Center-based services. Ano yung mga sample ng center-based services sa Singapore? Daycare center provides supervision, care, and recreational activities to seniors while their caregivers are at work during the day. What else? Senior Activity Center, which is provide a communal space for social and recreational activities for seniors living in the neighborhood, helping them to stay connected to the community. The next is Community Rehabilitation Center, which is provide therapy service to enable senior to regain or maintain their ability to perform daily activities. So ayun guys lang ha. I hope may natutunan kayo sa akin. Bye-bye! Thank you ulit!